Today's video is going to look at what we mean when dentists or other professionals use the term arch form and take a closer look at how that arch form shape comes to be. So, when we are talking about, before we talk about the actual shape, we want to know what kind of things influence the shape of the arch form. So we're going to be talking today about how the tongue position should be at rest or during action when it's being used to function, and how when there's an imbalance between the muscles of the tongue versus the lips and cheeks, that this can affect growth and development. So in this image here in the center, just kind of have these arrows showing this is the outline of someone's face. These kind of white parts right here are these upper set of upper teeth and set of lower teeth, just kind of orient. And this is meant to show you that the tongue position should be both up in the roof of the mouth and forward. So for contrast with that, we see here, this is a snip of a 3D image that shows this black space is empty space. So someone's tongue is in this part and it's not filling up, it's not resting up into the roof of the mouth. And so our focus today is on kind of arch shape, but very important to keep in mind that when the tongue is not in the proper position, the only place it can go, if it can't go up and forward, is to go back into the airway space. So these are different patients, kind of showing one patient with good airway space, another patient with poor airway space, but there can be a different variety of reasons. So in this case, both of these patients, their tongue resting position is up, but there just already may not be enough space to comfortably fit the tongue. The development didn't go as planned. And so as a result, the tongue takes up more of the airway space, leaving less space to breathe through. So when we talk about arch form, we're talking about kind of, if you think about it in equivalent terms to some sort of architecture or cultural icons, we're looking at arches. And in this case, we're looking at the arch that the teeth make in how they sit in the jaw. So in this case, what we don't want to see is a V-shaped arch. So kind of more, in technical terms, more of like a Gothic arch, making this upside down V. And what we have is this forms when the tongue sits low and back. So instead of sitting up into the roof of the mouth and forward, the balance, it's not in balance. So the lips and the cheeks kind of put more pressure on the way that the arch is forming, and the tongue is not there filling this space in order to provide kind of a counterbalance. So it almost collapses what we would normally have as a nice broad arch. And down here, that's just to show what that looks like from the front. It can result in what we call cross bites, where the top teeth, which should be out, kind of outward of the position where the bottom teeth are, get crunched in. So this is what happens when we have, not in all cases, but in some cases, when you have a constricted arch, it can result in that. Alternatively, what we do want to see is a nice U-shaped arch. So again, here we're kind of more of a classic Roman arch here, and that's formed by the tongue more properly filling the space that it should in the roof of the mouth and being in better balance with the lips and cheeks. So this is what we do want, is a nice U-shaped arch. One thing to mention is that it's not one or the other. It's not only a V shape or a U shape. Those are just two of the more commonly referred to arch shapes. And in this case, guess maybe you would almost call this like a more squared arch shape. This person, just in this photo, their tongue is back, but you get the idea that their tongue may sit back more often, which is then resulting in the lips pushing these teeth here back a little bit more. And then kind of also to mention that it's not just the kind of overall shape of the arch that's affected by the tongue position, but also the angle of how the teeth are. So if you think about the fact that every single crown or every tooth has kind of this chewing surface on it, in this image, the chewing surface is kind of pointing in towards the tongue or tilting in towards the tongue. And every tooth has a long root that comes off of it. So the root is kind of tilted down in the jawbone and the teeth are tilted in. So that further kind of restricts the amount of space that's present for the tongue. It's also going to put the teeth in a position that's more likely to see some damage take place. Sometimes there's gum recession or other damage that takes place as a result of the bite forces not being balanced from the way that chewing takes place or the way that the teeth come together. So then also I wanted to show you that in this image, there's kind of more of a U-shaped arch, but we don't have room for all the teeth. So we would need to make sure that the arch is growing to the right shape, but also growing to be wide enough to have the space to fit all of the teeth it needs to fit. Unfortunately, commonly in the past and sometimes still today, some teeth, as they may not at first appear to have space in the arch, are sometimes removed and the space is closed rather than growing to make sure that we can expand and make room for all of the teeth. It's about so much more than the teeth. It's about creating proper face shapes that are going to allow better breathing, better function. And up here, I just wanted to show that the arch form on its own, we look often at just the top or the bottom, but sometimes you want to look at kind of how the arches, the top arch and the bottom arch are meeting together. And sometimes the tongue position, if it's kind of commonly resting down instead of up in the roof of the mouth, it can put pressure forces here on the sides of the teeth and create almost a space if every time you swallow, the tongue is pushing into that space. And again, it's not met with a equal and opposite force provided from the cheek, then these teeth can kind of move out of the way from what's pushing on them. So this is meant to be kind of an overview. If you've heard the term arch form and it just isn't a familiar term, this is meant to be kind of an overview of all of that. And again, there are a variety of solutions to address arch form, but the important takeaway here is that one, we need professionals and tools to help make sure that the tongue is resting in the proper position with the proper amount of strength and force that's going to allow for good development of the jaws and of the face. So if you have questions or you want to talk further about what kind of providers can help with that, happy to help guide you in the right direction or talk you through that. Thanks so much. Hope this is helpful.